Hello, my name is Dr. Patricia Coughlin, and I'd like to welcome you back to the ISTDP Institute website. Today I'll be talking to you about the next step in creating a collaborative alliance with your patient. Research suggests that the alliance is not simply the result of therapist warmth and empathy. Instead, it's the result of a collaborative effort between patient and therapist to reach an agreement on the nature of the problem, the treatment goals, and then the therapeutic task. In order to be consistently effective in this effort, the therapist must develop powerful interventions that are consistent with his theoretical understanding of psychopathology and are also supported by research. So, if you're a biological psychiatrist and believe that symptoms like anxiety and depression are caused by a chemical imbalance, you're going to prescribe medication to address that imbalance. But as dynamic psychotherapists, we believe that the cause of the patient's symptoms and suffering often lie in unconscious conflicts. We're not interested in helping patients simply manage their symptoms. Instead, we attempt to expose the underlying cause of the symptoms, their conflicted feelings toward others, so that they can be resolved at the source and eliminated altogether. So let's look at what we mean by unconscious conflict. Dr. David Mallon has used two triangles as a way to help us conceptualize these forces within the psyche. At the bottom of the triangle of conflict are core emotions like love, grief, anger, guilt, and fear that are characteristic of our species. Recent neuroscientific findings support the notion that human beings are wired for emotion and emotional connection with others. Our basic human feelings are built into the system and have been selected for throughout evolution. However, we often learn early in life that our basic feelings, needs, and desires and impulses are not acceptable. If we get punished or isolated for expressing these feelings, they're going to get associated with anxiety. Now, anxiety is a pretty uncomfortable state, and we're highly motivated to find ways to avoid or reduce it. These avoidance strategies, which reduce anxiety and cover up our threatening feelings, get reinforced. This is the essence of what we call the triangle of conflict. Now remember, defenses often work, right, to reduce anxiety and avoid threatening feelings. They're also often adaptive in childhood, but they become rigid, outmoded, or overtly destructive in adulthood. When defenses become automatic and pervasive, they create the very symptoms and suffering the patient comes to get our help with. This is where the triangle of person comes into focus. This chain of unconscious events, feeling, anxiety, and defense, which has its origin in the past, gets repeated in the patient's current life and is often apparent in the relationship with the therapist. Our goal is to acquaint the patient with these emotional forces in order to break that chain of automatic functioning and put the patient back at choice. So now let's look at how we can use this knowledge and understanding to intervene effectively and solidify the alliance. Once the patient identifies a problem they're having, say depression, and can give you a recent example of the problem, we're going to begin to inquire about the feelings that were evoked in that recent situation. So let's look at a patient of mine. She came in saying that she had fallen into a depression after being yelled at by a customer. She reported that she had burst into tears and then had to run to the bathroom with stomach pains. Since then, she'd been unable to shake feelings of sadness, worthlessness, and depression. So I began by inquiring into her feelings toward this man. "What's your feeling toward him?" I asked. "I don't even know him, really. I just feel awful," the patient responded. Now, notice she doesn't answer the question. Rather than facing her feelings toward this guy, she resorts to the defense of rationalization, right? And then she ends up feeling awful. This must be pointed out to her. So I say, you end up feeling awful, but that doesn't say what your feeling is toward him. How do you feel toward this man? "Well, I don't think he was very nice," she said. "That's a thought, but what's your feeling?" I ask again. "Wow, why can't I tell you my feeling? I always thought I was in touch with my feelings, but I guess I'm not," she said. Now this is a very important moment. The patient realizes that she's been mistaking her defense of intellectualization for her real feeling. And she's distressed by it, which means that she's starting to turn on that defense, the very defense that's hurting her. So I go on to ask, so is that what you want to discover? What the feeling is toward him? Yes, she said, I know I should be angry. I mean, he was really rude. Now I will simply block her remaining defenses of tentativeness and continue to invite her to face her true feelings. You should be, or you are, I asked. Well, I guess I am. Again, are you or not? I am, damn it, she finally says. Okay, I said, let's look at how you feel that anger toward him right now. At this point, she says, well, now I'm getting nervous and I can feel tears coming up. So I responded to her, it's great that you noticed that because this is the engine to your depression. Rather than feeling your anger toward this man, you get anxious and then weepy. You keep the feelings inside and then you end up feeling awful. I really see that now, she said. This is terrible. Okay, so I can put her a choice. Do you want to feel that anger or do you want to keep it inside and feed your depression? I want to feel it, she said. So here, you can see how I worked the triangle of conflict in the current situation with this abusive client. The patient is now aware that she was anxious about her anger and that she had been suppressing it with rationalization, tears, and weepiness. She also saw that she had channeled her anxiety into her gut and ended up with stomach pains. So the attack was really on her. When she got in touch with the physical experience of her anger, aggressive impulses got mobilized. She realized she wanted to punch him in the stomach and was able to see that she had also suppressed that impulse, creating pain in her own stomach. Helping her see this one-to-one relationship between her symptoms and defenses and the suppressed feelings and impulses is essential work in undoing the depressive mechanism. She was able to see and experience how she had turned her anger and aggression back onto herself. This increased her motivation and revived hope, two crucial elements in any therapy. I hope this example helps you see how through the process of inquiry, patient and therapist can discover the underlying causes of the patient's symptoms and suffering. In ISTDP, we ask the patient about his feelings. We don't tell him what he's feeling. This is very important. We're not omnipotent, the all-knowing therapist, but a resource, a collaborator in the exploration of the patient's inner life. We ask, inquire, and probe for feelings while blocking defenses and monitoring anxiety. In so doing, we help the patient discover what is true for him. As Frieda from Reichman always said, the patient is in need of an experience, not an explanation. By helping the patient experience his true feelings, rather than getting anxious and resorting to defensive avoidance, we can help him have a corrective emotional experience. It's also an experience of authenticity, of being real, alive, and self-expressed. This seems to unleash a healing process within the patient that has been blocked and suppressed by excessive reliance on defenses. Our emotions are a kind of internal guidance system. They contain information and energy. Without access to our deepest feelings, we can easily get lost. By helping patients get in touch with their feelings and desires, they can get back on track and make healthy choices. Thanks for coming to the ISTDP website. In the next video segment, I'm going to be talking to you about how to get an agreement on the therapeutic task. I'll see you then.